Understanding gallstone size and risk. Gallstones can range dramatically in size, from tiny grains of sand to golf balls. Size matters when determining symptoms, complications, and treatment options. Learn what makes certain gallstones dangerous and when medical intervention becomes necessary. Gallbladder. Gallbladder, located just below the liver, is a storage reservoir for the bile juice. Bile is secreted to the duodenum for digestion during a high-fat meal. Gallstones. 3 common types of gallstones: cholesterol, pigment and mixed stones. Inflammation and infection of gallbladder caused by the obstruction of a gallstone at the bile duct. Gallstone size matters, from sand to golf ball. Tiny stones. Less than 5 mm. Often symptom-free and may pass naturally through bile ducts without intervention. Medium stones. 5 to 10 mm range. May cause discomfort and pain, requiring medical procedures for safe removal. Large stones. Over 10 mm. Pose serious risk of blockages, inflammation, and infection, often require surgery. Giant stones. Golf ball size. Extremely dangerous with high complication risk, always require immediate surgical removal. Why size determines danger. Formation factors. Gallstone size depends on how long they've been developing and their total number. Some patients have one large stone, while others develop multiple smaller ones simultaneously. The composition, cholesterol or pigment stones, also influences growth rate and potential complications. Larger stones cannot navigate through narrow bile ducts, creating dangerous blockages that prevent proper bile flow and digestion. The critical 10 mm threshold. Gallstones larger than 10 mm are of particular concern. These stones pose significantly greater risk of complications including bile duct blockages, inflammation, and serious infections that may require immediate surgical intervention. Medical imaging like ultrasounds and CT scans help physicians accurately measure stone size and assess overall gallbladder health to determine the best treatment approach. Warning signs: when to seek medical help. Pain signals. Persistent abdominal pain, especially in the upper right area, and discomfort that doesn't subside. Digestive symptoms. Recurring nausea, vomiting, and digestive upset following meals, particularly fatty foods. Infection signs. Fever, chills, and signs of inflammation indicating potential gallbladder infection. Visual changes. Jaundice, yellowing of skin or eyes, and gray-colored stools indicating bile duct obstruction. Don't ignore these symptoms. Early consultation with a healthcare professional can prevent serious complications. Gallstones are hard deposits of substances in the bile that can form inside your gallbladder or bile duct. Gallstone size chart in mm and chances of passing naturally. Treatment options by stone size. Treatment approaches vary significantly based on gallstone size, symptoms, and individual patient health. Your physician will recommend the most appropriate option for your specific situation. Small stones, watchful waiting and medication. Stones under 5 mm. Most gallstones smaller than 5 mm don't cause symptoms and often pass naturally without requiring treatment. Your sodiol medication can dissolve certain types of small cholesterol stones over several months of treatment. This non-invasive approach works best for patients who prefer to avoid surgery when possible. Regular monitoring ensures stones aren't growing or causing complications. Medium stones, ERCP procedure. Endoscopic access. A flexible tube with a camera is guided through the mouth, down the esophagus, and into the bile duct opening. Stone location. The physician visualizes the bile ducts and locates stones causing blockages or symptoms. Stone removal. Specialized tools extract stones directly through the bile duct, avoiding surgical incisions. ERCP, endoscopic retrograde cholangiopancreatography. Effectively treats medium stones between 5 to 10 mm that cause pain or discomfort, offering faster recovery than surgery. ERCP treats medium-sized stones. Large stones, surgical removal. Laparoscopic cholecystectomy, the gold standard. For gallstones larger than 10 mm, surgical removal of the entire gallbladder is typically recommended. This minimally invasive procedure uses small incisions and a camera to safely remove the gallbladder. Minimal scarring. Tiny incisions heal quickly with minimal visible scarring. Fast recovery. Most patients return home the same day or next morning. Normal life. Resume regular activities within 1 to 2 weeks post-surgery. Key takeaways: size matters. Small stones under 5 mm often resolve naturally. These typically don't cause symptoms and may pass without intervention, though monitoring is still important. The 10 mm threshold marks increased danger. Stones exceeding this size significantly raise complication risks and usually require surgical treatment. Treatment depends on multiple factors. Size, symptoms, location, composition, and your overall health all influence the best treatment approach. Early consultation prevents complications. Don't wait if you're experiencing symptoms. Professional medical evaluation ensures the safest, most effective treatment path.